All right, so here are the lungs and the heart. This is how they're going to sit in that thoracic cavity. So we have 3 lobes on the right side, 2 lobes on the left. The 2 lobes are to facilitate the fact that the heart sits down and rotated. This model does not really, well, yeah, it kind of shows the lobes. We're going to have our superior, middle, and inferior. You can also call them, or you'll note in your book, they may also be called apical, middle, and diaphragmatic. Either name is absolutely fine, doesn't really matter. On the right side, we're going to have 2 fissures. Fissure just means division. Okay? We'll see our horizontal fissure here. That's the division between the middle and, or excuse me, the superior and the middle lobe. And then our oblique fissure here is going to be between the middle and the inferior lobe. On the left side, we're going to have our superior lobe and then just the inferior lobe. And we'll have only an oblique fissure dividing the 2. What we also see on the left lobe is what's called the lingula. I just really like this word. It means tongue. And what it does is this kind of wraps around the apex of the heart. Now this has more clinical significance, but it'll actually fill what's called the cardiac notch as the heart expands with blood. But as far as you're concerned, it just gives the heart a hug. Okay. As we were to take these off, what we can see on the inside, this is called the mediastinal surface in here. This area in here where we see the bronchi, the arteries, remember they're flip-flop in the lungs and the heart, the arteries and the veins are. We'll see the pulmonary arteries and veins and the bronchi. This area is going to be called the hilum, okay, where we have this conglomeration of things that are responsible for supplying the lungs as well as the heart in this area. So we can also see here these are going to be veins dropping into the heart, brachiocephalic and subclavian dropping in. This is going to be our aorta coming into the heart. Back here, these structures, this pink thing, this is going to be the esophagus. Until it crosses over the aorta, it's actually the most posterior structure in the thoracic cavity. And then this here, this is considered at this point in time, there we go. This is considered the thoracic aorta or the descending aorta until we get down to the diaphragm, then it changes names to the abdominal aorta.